How USA health insurance work. Healthcare in the United States can be very expensive. A single doctor office visit may cost several $100 and an average their day hospital can stay run tens of thousands of dollars depending on the type of care provided. Most of us clout not afford to pay such large amount. Specifically, sign we don't know when we might become ill or injured or how much care we might need. Health insurance offer a way to reduce such cost to more responsible amount. The, the way its typical work in the consumer pay an upfront premium to a health insurance company, and that payment allow you to share risks with lots of other people who work making similar payments. Signing most people are health most of the time. The premium dollar paid to insurance company can be used to cover the expenses of the small number of who get sick or injured. Insurance company, as you can imagine, we risks and their goals is to collect enough premium to cover medical cost of counselor. There are many different type of health insurance plan in the USA and many different rules and argument regarding care. Following are their important question you should ask when making a decision about the health insurance that will work best for you. Key question where I can receive care. One way the health insurance plan control their cost is to insurance access to providers. Providers include philosophics, hospital, laboratories, performings and other. Many insurance companies control with a specific network of providing that has agreed to supply service to plan. E-controllers at more preferable speaking. If a provider is not a plan network, the insurance company may not pay the service provider or may pay a similar portion that it would form in network case. This means the insurer who goes outside of the network for care may be recommended to pay a much higher share of the cost. This is an important concept to understand, specifically if you are not originally from the local state front area. If you have a plan enough a parent for explain and the plan's network is in your hometown, you may not be able to get the care you need in the Stanford area of you may insurance much higher cost to get the care. What does the plan cover? One of things healthcare reform has done in the USA is to introduce more to insecure plan benefit. Before such, the plan benefit offered varied in destiny from plan to plan. For example, some plans cover specifically, others did not. Who plan in the USA are recommended to offer a number of health benefit which incite emergency service, hospital visit, laboratory test, material and newborn care, mental health, doctor and other service you receive outside a hospital, rehabilitation service. From our international population of students who might be considered thought a non-US based plan, asking in the question what does the plan cover is extremely important. Question number 3. how much will it cost? Understanding what insurance coverage total cost is totally quite completed. In our overview, we talk about paying a premium to enroll in a plan. This is an upfront cost. It is transparent to you. Unfortunately, for most plan in this is not the only cost. According to with your care your service, there is also typical cost when you access care. Such cost in capture as reduce coin insurance or company and the share you can pay out of your own pocket when you receive care. As a general rules of thumb, the more you pay in premium upfront, the less you will pay when you access care. The less you pay in premium, the more you will pay when you access care. The question for our student is pay as a longer share or now or pay is a larger share later. You will pay the cost for care you service. We have taken the affirmance that is it's better to pay a lesser share in the upfront premium to minimize as much as possible costs that are reduced at the time of service. The reason of our talking is that we don't want any behavior to care such a high company to the time of service to diagnose student from getting care. We want student access medical care whatever it's needed. Thank you everyone.